there are two systems in one, the training portal and the patient management and reporting system. When you go to the landing page of your system, when you come here, there is an icon on the right end of the page. When you click on that icon, it gives you a drop-down menu of login to patient management and reporting system, login to training, contact and support, about. If you are using the patient management and reporting system, click on login to patient management and reporting system. Today's session is about system configuration. The patient management and reporting system consists of 3 modules and they are defined as roles. We have the administration role that controls configuration of system, creation of users and accounts, supervision of data entry, and history tracking of patients. And the history tracking involves looking at address change history, looking at screening history, and also looking at pregnancy histories of clients. Today, we are going to focus on configuration. The configuration is important and is compulsory that you do before system use. If you have configured your system in the past, you just need to look through what you have there. If there is something new, you can add. If you need to update, you can update. To configure the system, you have to enter all the system's dependent variables. And the dependent variable for the system are the testing sites, the management sites, the ethnicities, the health districts, the parishes, the pharmacies, the drug and treatment regimen. You want to enter one uniform name that the doctors select from the drop-down list. You want to put in the vaccine list that are given out so that when it's time for you to give vaccination, you don't need to type in, you just select the vaccine you are giving because the system already has a list that you populated. The screening list will consist of the list of different screenings. And the reason we made this dynamic is you don't want to start rebuilding the system next year if there is a new type of screening that is recommended for TB or for HIV. You just come to the list, add it, and it's part of the system. So it makes maintenance very easy. It makes the system dynamic for anybody with a minimum level of IT experience to be able to update the system, or with no level of IT experience to update the system. Test modalities also, you will enter the modality of testing. Is one of the new reporting indicators for 2022. I don't know if it's announced in the region yet, but I've seen that UNAIDS and WHO have updated all of their indicators to include screenings by test modality. So I'm adding it so that by the time they make it required reporting for the countries, you already have it and you're already collecting that data in the countries. You also have the vaccination schedule that you will create for the countries. So when any adult or baby is being given a vaccine, it will populate based on the schedule of vaccination. So the nurses or the health centers will know that at birth, we are supposed to give the first dose or second dose. And then when they give that vaccine, they can check or click on giving and click on giving when the patient is, or when the client or the baby has been given the vaccine without having to type. So we want to make it easy for the users by configuring the system ahead of time. Then you have the reporting dependent variables. So when you have to calculate things like screenings per 100,000 population or births per 1,000 population, you don't want to take your paper and start calculating. You want the system to automatically generate this. And that is where you put the reporting dependent variables. You enter your census population by sex and age group. Now, the common age grouping that is used internationally and I think regionally also, every country submitted the same age group, a 0 to 4, 5 to 9, and that pattern. So you have a drop-down menu where you select that, you put in the census year, the male population, female population, and total population. Now, I was going to auto-calculate this, but I did not auto-calculate this because the countries are recording a binary gender of male and female. And then there are babies born with unknown gender and then or intersex. And then they are recorded as unknown and they are not recorded as intersex. And then when you calculate male and female, it doesn't give you the total. So the difference between the addition of male, female, and total will give you the population of people whose sex are not known. And because it's not formally entered in the countries, I do not want to create it that way, and I don't want to auto-calculate the total so that you have the ability to put in a total figure that is reported but doesn't add up when you add the male and female population. Then another dependent variable for the basic reporting is the national census, the national births by sex. You enter the year, the number of male births, the number of female births, and the total number of live births. You have to enter the live births because you can have male births and female births, but some are stillbirths, right? So you enter male births, female births, and then live births. Then we also have, for basic reporting, mortality by age group and sex. So you also choose the year, the age group, the number of male deaths, female deaths, and total deaths. It doesn't matter the cause of death, just put it on a national level, what the figures are. On the patient form, you are going to select when there is a death, if it is HIV related or an HIV death. And then the system can calculate number of HIV deaths per 100,000 population or HIV related death per, and whatever the indicator is. But for this configuration, we are going to be using data on a national level. Then you enter in child mortality. So all the mortality after birth to, I think, some number of months, you're going to enter there on the system according to the records you have. So these are the basic reporting. For advanced reporting, if you want to do correlations and want to find out maybe some inferential statistics of what affects what or what causes what, you begin to enter things like national census population by census division. This is not compulsory that you enter this before implementation, but I put this here in case in the future you now need to submit reports broken down by census division. Some countries submitted census data that is recorded by census division or by health districts, but in groupings, and you can get the national figure from there. So in the event where you want to start having records or reports that tells you the positivity rates per health district or per census division, the system can accurately calculate this because it knows the population of that particular region or parish or health district that the grouping of the census used. Then also for advanced reporting, you enter economic variables. You want to know if HIV positivity rate goes higher when the GDP is high or when it's low. You want to know if the health expenditure is high, the HIV comes down, those kind of correlations. You enter economic variables here. You need to enter the GDP, the government expenditure, the educational expenditure, and the health expenditure. That way, the system can correlate to see if there is a positive or negative correlation between positivity and these economic variables. So that is for a different type of reporting that is not part of the list of indicators, but you might need it in the future or for national planning. And then you want to enter national births by census division. So everything that is by census division and the economic variables are not required to be entered before implementation. But when you need them in the future, you have to enter them for the system to auto-generate reports by those classifications. Any questions or suggestions or clarification before I go further? So I'll take it that everybody is okay so far. So we configure testing and management site. I put in the chat the email and a password for participants to log into and create a hypothetical site or a real site in your country on the system. I also asked that ethnicities should be created. You look at the list. If you want to add any ethnicity, it can be hypothetical, it can be real, just put in anything for ethnicity. It can be race, it can be a group of languages in the country. Whatever classification you use for ethnicity in your country, you can use that here. Then you can also configure health districts by entering the health district in your country or some hypothetical health districts. Then you want to enter the names of the parishes and also the pharmacy list. So the list of pharmacies in the country that dispenses ARV for all pharmacies if you have a full list of it. Then you want to also create the drug and treatment regimen. I have populated this with a list of TB and HIV drugs and classify them as first line, second line, intensive phase, or continuation phase. And it's there. So if you have more on the list, anyone that is not correct or not used presently, you can delete, you can edit, you can add. Then we have the vaccine list, where you put in the names of all the vaccines that are used in this life and the country gives. If you use vaccines that are not on the list already present, you can add more vaccines here. Everything that has to do with vaccine is populated from the list you create. So if you don't put in a list, the drop-down menu on the forms will not have that name. So every time you want something on the drop-down menu, you have to come back to configuration to find out if the system allows you to add a new one, and then you add it to the list. And then all the forms on the system automatically has that new added name on the list of whatever it was. Then screening list also, you add the names of all the screenings. So if next year there's no longer HIV rapid test, let's say a research comes out and tells you that rapid tests are not accurate, they want to stop the use, you can decide to add a new type of screening that is being used. So this is where we stopped before the break, and I am going to add more screenings that we use. So we do RPR, and we do that for syphilis. Some countries use VDRL instead, and it's also for syphilis. We use TPPA for syphilis. Some countries use TPHA. We also do FTA sometimes. And then you have, let's say, HIV, use ELISA. And this is for HIV. We have the HIV antigen antibody test. So I'll put HIV AGAB. And this is HIV. We have syphilis rapid test. And then let's put in some tests for TB. You use the expert gene machine for TB. You can also use, for TB, we can also do the AFB, let's see, acid fast. Let's say acid fasting. So there are other TB screenings that you use in the country. You can add them to the list. If you do the IgM and IgG, you can also add that to the list for the TB screening. Then we have screenings for hepatitis. Let's say we want to put hepatitis B surface antigen. We want to do, let's say, HCV PCR. We want to do hepatitis B for antibody. We also want to do routine screenings. You want to do a complete blood count. And this is routine. So any screening that you can classify as HIV, syphilis, TB, or hepatitis, you just put the screening as routine. Let's do urea, bone, sorry. And let's do creatinine. So I'll add this to the list. Then I will add more later on. So you can get a list of screenings from the lab and put in an exhaustive list of screenings, because you know that clients with HIV or syphilis, you might want to do things like chlamydia testing. And this is routine. You might want to test for gonorrhea. And this is routine. You might also want to do an HB electrophoresis for a pregnant client. I think my spelling is going to be wrong. I think the spelling is wrong. Yep. And routine. And then you can also do a sickling test if you don't do the HB. And routine for both the pregnant mother and the baby father. You might want to do a gram stain as routine. So there are an exhaustive list of screenings. You can add what you normally use, the doctors on the call, add the list of screenings you normally use for routine visits for clients. And so you can do a liver function test, kidney function test, or a renal panel and a liver panel, add them to the list. Dengue fever and all sorts. So I'll stop here with the list, but you get the idea of how to put in screenings, so that when you are filling in a screening form on a client's page, it gives you a drop-down menu of all the screenings you have entered, and you just click on the screenings instead of typing. That way, the system has a uniform naming across all users, and when you want to report, the system can pick out the name uniquely, because one name means the same thing throughout the country. Any question? Okay, I'll take it that there is none. And then you want to put in test modalities. Now, according to the UNAIDS manual, they have a naming for test modalities that can be a bit confusing. You might want to put in names according to what the original naming means, so that reporting by test modality, so if they ask you, they want to get HTF reports, like positivity rates by HTF, you know exactly that means self-test. If you name the modality as self-test in your country, you know what it means. So if you want to make it less confusing, you can name it what you want, but always know what the standard or international naming is. And you can always refer to the standard naming, or you can compare or match the standard naming to whatever name your system uses to get the accurate figures that you want. So I'm going to use a standard name here. And we know by definition, this is not the number of people who had a self-test, but the number of self-test kits that was distributed. If you are going to be recording the number of self-test kits distributed, you're going to choose this. We have another indicator, which is HTS TST. Everything from the other list, like HTS index, are all part of the TST. But if you put this, you can get yourself confused. So you want to do things like self-test. So I want to put self-test. I want to put confirmatory test. So for self-test here, I can put now HTS self. And then for confirmatory test, I'll put in the name HCS recent. And this is also a testing indicator. For rapid test, RTI, and this is rapid test for recent infection. Testing indicator. I will also add let's put like testing in a mobile facility, testing, community testing, and we'll also add things like facility testing, VCT, NGOs. So there's an exhaustive list of these naming conventions that are very confusing. You might not want to use that. We have something called HTS index, which is for an index client. If the index is a child, you want to also, once the result is positive, you want the healthcare provider to know that because that child is positive, the mother has to be screened. If the mother is not available or the mother is diseased or there's no record of the mother, you want to screen the father of the baby. You want to screen all the siblings of that child. If the index child is a mother, you want to screen all the children of the mother and the sexual partners, the injection drug partners, or any other partners that have the risk of being infected. We'll not use HTS index because it will confuse us. You can do things like community-based testing, and you put it as index, testing indicator. I'm using namings according to what I feel, but you in your country will decide how you want to create these test modalities. When we get to the surveillance part of the system, you will see how the system reports testing and disaggregates by the positivity by test modality. It is a new testing indicator that will be required from the countries going forward. So I added it here so that you will have that data when it is required. Then you have community-based testing that is and this is, let's say, you can just give a double name mobile. So this like in a school and outreach, things like that. So testing that you do in an outreach, you want to put them here, or you just want to write outreach as a name. But then if you put outreach, it's going to be classified as just outreach. If you put mobile, it means maybe you went to a school for a workshop, you did testing for the teenagers in the school, you went to the marketplace, you went for, you put in a tent, a testing site in a tent, maybe on a Saturday, you'll have a tent outside a shopping mall for people to test. So all those go in as mobile testing, but they're community-based testing. And then if you want to, you can put in a name like VCT in a health facility and also VCT in an NGO. You can also have TB, which is testing for a confirmed TB case. You want to put things like VMMC, and this also is for So maybe in the hospital, you have voluntary medical male circumcision. If the testing is for that circumcision, you want to classify as VMMC. If you want to put provider-initiated testing and counseling, and this is at the emergency room, you want to also have PITC, but this is on inpatient. You also have PITC for maybe malnutrition. So this just gives you the modality of testing, the place or reason. If you are doing PITC for pediatric less than 5 years old, or you are doing PITC, PMTCT, sorry, screening for PMTCT, and you are screening on the first antenatal visit. So it will be PMTCT ANC1. Those are the naming convention. If you are screening post ANC, it will be PMTCT post ANC. And so you can look at the manual that will be distributed later to see all of the exhaustive list of test modalities that you want to configure the system with. If you also have an important one is like STI. So people with other STI infections and are testing for HIV want to put STI as their test modality. Any questions so far? Any recommendation? Anything confusing?
None so far from me.
Okay. So we have looked at the test modalities. Now it's time to create vaccine schedule for the country. So again, you want to make consultations with whoever is in charge to know what the correct schedule the country uses is. Different countries might use different vaccine schedules. So you put in what you do. Let's say, for instance, we want to give hepatitis B vaccine. We want to give this at birth. And at birth is going to be the first dose, right? You want to give the same hepatitis B vaccine, and you want to give it at 1 to 2 months. And this is going to be the second dose. The same hepatitis B vaccine is given at, let's say, 18 months. So you change this according to how you give the vaccine, the name of the vaccine, the age range when the vaccine should be given, and the series. If it's a one-time vaccination, if it's an annual vaccination, if it's first dose, second dose, third dose, fourth dose, fifth dose, up to 10 doses. We're having boosters, first, second, third, fourth boosters, as many as you give in the country. So let's say the third dose is given at 18 months, and you save this. If you're giving adult vaccination, the schedule for vaccination is different, and then you put it in there for hepatitis B. We can do the same thing. Let's do another vaccine. Let's say HIV. So you can see that this drop-down menu for vaccine is populated by what we entered when we entered the list of vaccines. If you don't find the vaccine you want here, you will have to go back to creating vaccine list and adding that vaccine here. Then you can now come back to creating the schedule of vaccination. So now I want to put a schedule for HIV. Do I have it? Yes. And we give the first month, let's say 2 months for the first dose. It might not be correct, so don't use what I'm using. Use what is correct. Let's say you get the second dose at 4 months. And this is going to be second dose. And you get let's say this is all about the series, and then you save that. And so you get the idea on how to create vaccination schedule. So when it's time to give vaccination on the vaccination form, on each client's page, on each baby's page, it will have the schedule already there. And then whoever is the user is going to tick whatever it is. Okay, you have taken the 2 months first dose, you take on it. There'll be a field we'll see in the coming weeks on the form where the user will enter if the accurate date and the time and the name of the person who took the vaccine, who gave the vaccine, the batch number, and all the data you need to enter on the vaccination card. It's going to be on the form, but this will be auto-populated for ease of use and to limit the amount of typing that users will have to do. So this is all about the system configuration for the system-dependent variable. Now we are going to move to the reporting dependent variable. Is there any question or suggestion or anything you think we have missed? Okay, all right. So we will look at the reporting dependent variables. And we said initially that the dependent variables for reporting are the national census population by sex and age group, the national births by sex, and the mortality by age group and sex. So we are going to try entering national census population by sex and age group. I'm going to enter just 2 records so we don't waste time. You can later on enter any information you want to enter. So once it is time for you to configure your training and life system for in-country use, you will get this list and then you will enter all of the information from the list you have. Make sure you get the correct list and the list from which department is responsible for that kind of record so that your reporting will be accurate. So we have this age group 0 to 4 for census year, let's say 2020. Now, if you are entering past records on the system, you have to enter the census population for the past years. If you want to enter only the most recent records you have of census population, let's say 2011 is the most recent, make sure that the record you're entering on the system is not prior to 2011. Or you enter census population that predates the record. The system during automatic reporting is going to use the census population for the census year that is less than or equal to the selected reporting year. It is not going to use 2011 census population for a 2003 record. It is not going to display reporting for you for those values because it has not found any census population that is less than 2003 or equal to 2003. So we are doing for 2011, the number of male hypothetically is 1,512. The number of females is 1,596, and we have a total number of 3,108. You will add rows and add for the next age group for the same year. And we have, let's say 1698. We have 1774, and we have 3472. So you get the idea. You keep adding for more age groups until you finish entering for all the age groups that you have recorded in the country. Now, there is one other thing that is not uniform in countries. And so I used the standard groupings. When you want to put in an age group, we have 0 to 4, 5 to 9, 10 to 14, 15 to 19, 20 to 24, 25 to 29, 30 to 34, 35 to 39, 40 to 44, 45 to 49, 50 to 54, 55 to 59, 60 to 64, 65 to 69, 70 to 74, 75 to 79, then 80 and over. If in your country you collect 80 to 84, 85 to 89, 90 plus, or you collect 90 to 94, 95 to 100, and 100 plus, you add all the figures you have from 80 to the last recorded year and put them together as a group of 80 and over, and then you enter the next record as 80 and over. So that is how you are going to enter the census population by sex and age group. And then when you are done with all the age group and all the figures, you can move on to the next census year. You have previous years, new years. So every time, so if in 2022 there is a census population released, a new one, you can come here and put in a new 2022. And the system automatically updates every reporting with the census population that is equal to the reporting year you selected or less than the reporting year you selected. But it must be the last highest value less than the reporting year. Is that clear? Everybody following, or it's confusing?
Can you repeat the question, please, Mildred?
So I'm saying, is it very clear or it's confusing? Okay. So we have the census population by sex and age group. We are going to move to national births by sex. And so for this also, you will need to have a record of the births in the country. And that record should have the births of the male. So we'll have the year. So let's say in 2020, we recorded the number of male births is, let's say 618. The number of female births are 653. And the number of live births is 1271. Now the number of live births might not equal the number of male and female births if you add stillbirths to the list. So you always have to enter male births, female births, regardless of the outcome later on or the outcome of the birth. And then you have to put in the figure for the live birth. Then you will save this. So this is the easiest to enter because it's just one figure for a year and it's not by age group. You can also enter this by age group of the mother, but we are not considering that on the system. So we also have mortality by age group and sex. So you're going to put in the record of deaths for the country, the age group of the people who died, the sex, male, the female, and then a total. So let's put in one. I will put in for year 2020. We have age group 34 to 39. And so we have 100 men die. We have 120 women die. And we have 220 total deaths. Then maybe I have record for, you make sure you enter record for all the age groups that you have available. So let's say we have 64 die here. We have 56 death here. And so this should give us a total of 120, if my mathematics is correct. 10, 11, so 120. And then I'll save this. So you get the idea of how to enter the records. So all of this makes up the system configuration part of the system. And this is all the functionalities of system configuration role or system configuration permission, sorry. The role is administration, the permission is system configuration. Any questions?
Mildred,
Yes.
Alexandrina Wong here. What source did you use to come up with the age group that you have there? Why I'm asking, in the community nursing services in Antigua and Barbuda, I am not sure if those are the age ranges that we would necessarily work with.
Okay, so what happened was during the development phase of the system, countries were asked to submit their age groupings, and all countries submitted exactly the same thing, this age group. So we used it based on the fact that it was uniform across the 6 countries, and this was the international standard for age grouping that is used for external reporting. So I don't know if, but I know Antigua submitted this age grouping. I have all of those records here, and all islands submitted the same age grouping.
Is it 30 to 34 or 20 to 34?
20 to 24, 25 to 29, 30 to 34. So it's like a 5 years gap age range.
Okay, thank you.
Okay.
Mildred, that's because that is what you would need to report to most agencies,
Okay.
especially USAID. You can just add up the variables if you need different age groups.
Yes. So if you need like 20 to 30, just add up from 20 to 24, 25 to 29 and get the total.
Exactly.
All right. So tomorrow we are going to do a review of what we did today and then move on to tomorrow's agenda, or we do it after tomorrow's agenda and review everything. From tonight, you will start getting an email to activate an account for your patient management and reporting system so that we can go on with practicals. We have a list of case scenarios that we are going to use to create, to enter records on the system. I will email or upload all of the case scenarios. So you need both accounts. You need your training portal, you need a patient management and reporting system. I will use the same email address. When you get an activation email, use the same password you used for your training portal so that either of the login form, you use the same email and password, and it makes it less confusing. So are we all good?
Yes, I'm good.
Okay. So thank you all very much, and we will see tomorrow morning.
Thanks again. Bye,
Thank
Mildred.
you. Bye-bye.
Okay,
Thanks.
bye.
Thank you, Mildred. Bye.
Yeah, bye.